Prostate cancer is cancer in a man's prostate. The prostate is a walnut-sized gland located between the bladder and the penis. Worldwide, an estimated 1,414,259 people were diagnosed with prostate cancer in 2020. It is the fourth most commonly diagnosed cancer in the world. So, what causes prostate cancer? Family history. Men with a family history of prostate cancer are more likely to develop prostate cancer than the general population, which suggests that in some cases, there may be an inherited or genetic factor. Having a father or brother with prostate cancer more than doubles a man's risk of developing this disease. The risk is much higher for men with several affected relatives, particularly if their relatives were young when the cancer was found. Diet. On a case-by-case basis, doctors cannot say with certainty what causes prostate cancer, but experts generally agree that diet contributes to the risk. Men who consume large amounts of fats, particularly from red meat and other sources of animal fat cooked at high heat, may be more likely to develop advanced prostate cancer. The disease is much more common in countries where meat and dairy products are dietary staples. The underlying factor linking diet and prostate cancer is probably hormonal. Fat stimulates increased production of testosterone and other hormones, and testosterone acts to speed the growth of prostate cancer. High testosterone levels may stimulate dormant prostate cancer cells into activity. Some findings suggest that high testosterone levels also influence the initial onset of prostate cancer. Exposure to heavy metals. Welders, battery manufacturers, rubber workers, and workers frequently exposed to the metal cadmium seem to be abnormally vulnerable to prostate cancer. Height. According to a research published in Cancer Epidemiology Biomarkers and Prevention in 2008, levels of a hormone known as IGF-1 in childhood may play a role in cancer risk. Taller men tend to have had higher blood levels of IGF-1 in childhood, and higher blood levels of the growth factor in adulthood have been linked to higher prostate cancer risk. The researchers found significant degree of risk, 6% for every 10 centimeter increase in height, when they look at the combined results of 58 separate studies of prostate cancer and height. They also found that height, especially in men with longer legs, was also associated with about 12% to 23% increase in risk for more aggressive high-grade prostate cancer. Taller men did not, however, appear to be at any greater risk for low-grade, slow-growing prostate cancer. High body mass index. Research was conducted by Cho et al. In 2020, and in their conclusion, they stated that in groups with abdominal obesity, A significant linear relationship was observed between increasing BMI and prostate cancer risk. The higher the waist circumference category, the stronger was the association with BMI, signifying that the association of BMI with risk of prostate cancer development depends on abdominal obesity. Haig et al. In 2014 also conducted the research, and in their conclusion, they stated that these results suggest that BMI at diagnosis is strongly correlated with prostate cancer mortality, and that men with aggressive disease have a markedly greater odds of death if they are overweight or obese. Low physical activity. Literally, hundreds of studies conducted over more than half a century demonstrate that regular exercise pares down your risk of developing some deadly problems, including heart disease, stroke, and certain types of cancer. What may come as a surprise is that regular physical activity may actually help prevent some prostate disorders and improve prostate health. Emerging scientific evidence suggests that engaging in a few hours of exercise a week may help keep prostate tumors from advancing or prevent them from developing in the first place. Smoking. Cigarette smoking may increase the risk of prostate cancer by affecting circulating hormone levels or through exposure to carcinogens. Laskin et al. In 2003 conducted a research titled Cigarette Smoking and Risk of Prostate Cancer in Middle-Aged Men. They concluded that smoking is associated with a moderately increased relative risk of prostate cancer. Furthermore, a dose-response relationship exists between number of pack years smoked and cancer risk. Given that smoking cessation seems to reduce these risks, results from this study have public health ramifications and suggest that prostate cancer should be added to the list of tumors for which cigarette smoking is a risk factor. Hancharek et al. In 2010 also conducted a research titled Smoking as a Risk Factor for Prostate Cancer, a meta-analysis of 24 prospective cohort studies published in American Journal of Public Health. It was concluded that there exists an association of smoking with prostate cancer incidence and mortality. Low tomato consumption. Emerging evidence from epidemiological as well as cell culture and animal studies indicates that lycopene and the consumption of lycopene-containing foods may be prostate cancer. Processed tomato products are the primary dietary lycopene source. Individuals with higher intake of tomato foods have a lower risk of prostate cancer compared with consumers of lower tomato intake. Zhu et al. 2016. Men who consume more than 10 portions of tomatoes each week reduce their risk of prostate cancer by about 20%, according to a UK study in 2014. African American race. For African American men, the risk of dying from low-grade prostate cancer is double that of men of other races. A new study has found 1 in 7 African American men would develop prostate cancer in his lifetime. Overall, African American men are 1.7 times more likely to be diagnosed with and 2.1 times more likely to die from prostate cancer than white men. African American men are also slightly more likely than white men to be diagnosed with advanced disease.